Hi, I'm Roger Levin, and I'm delighted to have a few minutes to spend with you talking about the current state of dentistry, especially in light of the economy as it is today. If anything, the last 2 years have showed us that dental practices need a very strong focus on production. When I lecture throughout the country, I'm getting more and more questions about production and increasing production than ever before. And the reason is that data is showing that 75% of practices at the moment are either flat or in decline. And you can look that up on the Dental Economics Levin Group Annual Practice Survey, October and November 2009. Based on that, I would like to share a few thoughts on production with you, and I hope these will be helpful. The first is that production comes from excellent practice systems. The formula that we're teaching at Levin Group is that systems create production, which creates income, which fills in portfolios. We don't want to lose sight of the fact that many doctors have had portfolio declines as well as practice flattening, and both need to come together now to put a doctor back on track for an excellent quality of life and long-term planning. Production is a factor of how the practice operates. And essentially, there are approximately 9 systems that need to be put in place. And when those systems are maximized, incredible results can happen. One of the things I love talking about is what is old and what is new. For example, in an old model, you went to work every day, you kept the chair full, patients came in, and dental practice seemed great. Today, that's not sufficient. We have more no-shows, more last-minute cancellations, insurance changes, patients leaving practices, a slight decline in elective services. But what's new? What's new is focusing on maximizing the current opportunities. For example, having 98% of all of your patients scheduled at all times, calling any patient who's overdue for appointments the day they're overdue, making sure that every patient understands there are 4 financial options, including patient financing, that they can take advantage of. Another example would be presenting comprehensive treatment to every patient, and where necessary, thinking about phased treatment options to increase the opportunity for patients to take advantage of care starting today. As I've often said, 25% of something is better than 100% of nothing. Now, those are just examples. The main message is that practices need to build their models based on a production philosophy. And it's not about greed, but production is the key driver, because without production, there is no profit. And what a lot of practices have done that's a mistake is think that all they need to do is reduce their overhead and everything will be fine. Now, reducing overhead can be good. It's always unfortunate if you have to cut back or lay someone off, but there are times where cutting expenses might be a positive feature. The problem is you can only cut once, and once you've made those cuts, there's nowhere else to go. So inevitably, production will have to go up, because reducing expenses increases profit, but only one time. If production does not go up, then profit will not increase either, and eventually the practice, very quickly actually, just hits another plateau. So you want to begin to build your practice systems to increase and create increased production. And if that philosophy is put in place, the practice will simply grow. Now, that requires systems understanding, putting in step-by-step processes, scripting for the staff, training the staff on the systems, and doing what I call getting dentists back to dentistry. Our philosophy is that dentists should spend 98% of their working hours chairside, focused on the patients, and the staff should be trained to run the rest of the operations throughout the day. When a practice can operate that way, the dentist is doing what the dentist loves to do, and at the same time, or simultaneously, the dentist is doing what creates production. Because when dentists aren't with patients, no production is created. The same is true for hygienists. In terms of hygiene, you want to maximize that entire area, because hygienists contribute 25% of the revenue to the practice, and they can make that 25% a bigger piece when the hygienist focuses on working with patients on ancillary services, carrying products in the office that patients need and want to purchase, and identifying comprehensive treatment options that the dentist can finalize with the patient. So I hope these few minutes have been beneficial for you. Obviously, we could talk about this for days on end, but if you step back and start to think, as Levin Group does, about creating production, The ideas that come to you, the systems you put in place, will take your practice to the next level. And a growing practice is the best defense against the current economy. Good luck to you.